Chest pain, Part 3. Patient profile, age. Chest pain in children may be congenital in origin. Degenerative, neoplastic, and vascular disorders are more common in the middle-aged or elderly. Sex. Males are more prone to develop conditions like ischemic heart disease and bronchogenic carcinoma. In postmenopausal women, the risk of ischemic heart disease increases in equal proportions as that of men. Comorbid conditions. Ask the history of diseases which are considered as risk factors for myocardial infarction, such as diabetes mellitus, hypertension, hyperlipidemia, and obesity, etc. A patient with immunocompromised malnourished state is at higher risk of developing recurrent pleural and pulmonary infections. Social history. Inquire about the patient's family lifestyle, daily habits, exercise, diet, and nature of the patient's work, whether it is hard work or sedentary. Ask about the use of alcohol and number of days in a week, and also the quantity consumed each day. Also ask about use of tobacco, the quantity consumed, and whether it is chewed or smoked. Smoking. Inquire about the number of cigarettes or BDs smoked per day and the duration of smoking. This may be presented in terms of pack years. Risk for development of bronchogenic carcinoma increases when pack years exceed 40. These parameters have been included in various scoring systems for chest pain and myocardial infarction, such as the Heart score and modified TIMI score, etc. Heart score. It is a scoring system to risk stratify the patients with undifferentiated chest pain. Various components such as the history, ECG findings, age of the patient, risk factors such as hypercholesterolemia, hypertension, diabetes mellitus, cigarette smoking, obesity, family history of coronary artery disease, and troponin levels are used in heart score. Each component is scored from 0 to 2, and the total score gives the heart score, which suggests the risk of major adverse cardiac event in the next 6 weeks. Clues to diagnosis of various conditions. Myocardial infarction. Symptoms include retrosternal chest pain with sweating, shortness of breath, palpitations, giddiness, confusion, hypotension, and shock. Ask about the history of similar complaints in the past, family history of coronary artery disease, and sudden cardiac deaths. ECG shows ST changes. Pericarditis occurring weeks or months after myocardial infarction is known as Dressler's syndrome or post-myocardial infarct syndrome. It is characterized by persistent fever, pericarditis, and pleurisy. Aortic dissection. History of sudden onset, severe sharp chest pain associated with giddiness, confusion, asymmetric or absent peripheral pulses, neurological signs, secondary to carotid or spinal artery involvement. Pleural effusion. It may be associated with fever, cough with expectoration, breathing difficulty, and chest pain, which may be aggravated by deep inspiration and coughing. Pneumothorax. Sudden onset chest pain, with palpitations, shortness of breath, following blunt trauma to the chest may suggest pneumothorax. Pulmonary embolism. Symptoms include chest pain, hemoptysis, palpitations, shortness of breath, giddiness, and syncope. Gastroesophageal reflux disease and reflux esophagitis. The patient may complain of heartburn, chest pain, sour taste in throat and mouth, early satiety, chronic cough, etc. Esophageal rupture or Boerhaave syndrome. It is characterized by sudden onset chest pain after vomiting. It may be associated with hematemesis, hypotension, and shock. Musculoskeletal pain. Fracture of ribs. Patient complains of chest pain, which worsens on deep inspiration, and on movements, difficulty in breathing. Tietze's syndrome. It is the painful swelling of one or more costochondral articulations, usually second and third. Herpes zoster. Burning pain with rash, involving a single dermatomy, might suggest herpes zoster. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.